friends, I'm Dr. Arun B Nair, consultant psychiatrist from Trivandrum. During the days of lockdown and COVID pandemic, many people all over the world who are suffering from various lifestyle-induced disorders are suffering. They are unable to follow the lifestyle restrictions because there is restriction in going out in public places and exercising. They are unable to get the food of their choice. They are unable to meet the consultants who they are regularly consulting for their lifestyle-induced disorders. And at some places, there is even difficulty in procuring medicines which they have been taking for a long period of time. The most severely affected population happen to be the geriatric population, above 60 age group people, who are not allowed to go out except for emergency treatment purposes. So there has been this news in social media that once the COVID pandemic has started spreading, many other diseases have mysteriously disappeared. There is no heart attack, there is no diabetes, there is no hypertension, there is no cancer. Everything appears to have disappeared. Nobody is visiting hospitals anymore. Such kind of news is being spread through the social media. But what is the reality about that? We can see that even in nations where COVID pandemic is spreading like wildfire, the most important cause of death at this point of time is not the COVID pandemic, but it is certain other disorders. For example, China. Even at the time when COVID was spreading like wildfire in China, when COVID was leading to the death of maximum number of people in China, death due to COVID was the 49th cause of death when you examine the statistics of disorders leading to cause of death. Come to Italy. It is said that COVID pandemic has got maximum death rate in Italy. Even though COVID is leading to a death rate of about 10% in Italy, even at this point of time, COVID deaths account for the 8th common cause of death in Italy. There are 7 other conditions which are leading to death of human beings in Italy at this point of time than COVID. So the fact is that it is not that these disorders have disappeared. These disorders are very much there in the population, but it is getting neglected because the entire society is after COVID pandemic. Everybody is bothered about COVID. The entire healthcare system everywhere in the world is fighting day out and day, night out to contain the COVID pandemic. So in this process, many other disorders and their proper treatment is getting neglected. We have diabetic people, we have hypertensive people, we have those with cardiac disorders, with cancers, with mental illnesses at their home, unable to take proper treatment for their illnesses, and those illnesses continue to take the life of people even now, even more than what the COVID pandemic is doing. There are reports of suicides, there are reports of alcohol withdrawal associated deaths. Lot of such disorders are still prevalent in our part of the world, even when COVID is spreading. So one thing we have to keep in our mind is that it is important to contain the COVID. It is important to take treatment for COVID, to diagnose it, to get tested for it, to maintain all the lifestyle restrictions necessary to prevent the spread of COVID. But along with that, there are certain things which a person should keep in mind to prevent or to contain the lifestyle-induced disorders which one is suffering from. Coming to mental disorders, we have a lot of people in our country suffering from various mental disorders. We have got elderly people suffering from dementia. We have got people suffering from mood disorders, bipolar disorder, depression, anxiety disorders, schizophrenia, a lot of conditions like that. So what those people with mental disorders should keep in mind during the days of lockdown. Number one is that never miss the medicines you are regularly taking without consulting your doctor. If it is not possible for you to personally go and visit your treating doctor, kindly get in touch with him either through telephone or through social media. You can communicate with the doctor regarding your present condition. You can send the photograph of your current prescription to the doctor. Tell him the complaints you are facing right now and get the dosage of medicine adjusted. You can try to buy the medicines from the nearest medical store if possible. If it is not possible to get those medicines from near your place, you can utilize the services of fire force or police forces who are delivering essential medicines to distant places as per the requirement of the situation. Number 2, along with taking medicines properly, it is very important to inform the treating doctor about any new onset problems. Maybe you may be getting some breathing difficulty, some headache, you have a feeling that you are becoming fatigued, you are suffering from fever. If any new onset problem surface, then also it is very important to consult your doctor, call the doctor or WhatsApp message him and inform him the current problems, and do take appropriate treatment as per the instruction of the doctor. Never stop the medicines completely without consulting the doctor. That's the first and foremost thing. Second thing is that it is very important to exercise regularly. Not only people with mental disorders, people with diabetes, hypertension, lifestyle-induced disorders, they all should do regular exercise. So what is meant by exercise? It is said that you have to engage in moderate exercise for 150 minutes a week, at least spread over 5 days a week, to prevent the complications of lifestyle-induced disorders. So what does this moderate exercise do? Let me explain to you. There is a concept called maximum heart rate. Maximum heart rate is the maximum number of times your heart can beat per minute. There is a formula to calculate the maximum heart rate for every person. 220 minus your age will give you your maximum heart rate. So imagine you are a 40-year-old person. 220 minus 40 would be 180. So 180 beats per minute is the maximum heart rate for a 40-year-old gentleman. If you are 60 years of age, 220 minus 60, that is 160 beats per minute, is the maximum heart rate for your age. So moderate exercise means any activity in which your maximum heart rate is 60%. Your heart rate is 60% of your maximum heart rate. Any activity in which your heart rate is 60% of your maximum heart rate is called moderate exercise. So for a 40-year-old person, maximum heart rate is 180 per minute. 60% of that would be 108 beats per minute. So if a 40-year-old man is engaging in any activity in which his heart rate is at least 108 per minute, that is moderate exercise for him. For a 60-year-old man, 160 is the maximum heart rate. 60% of that is 96 per minute. So if you engage in any activity in which your heart rate is 96 per minute at least, that is moderate exercise for you. So 30 minutes of moderate exercise in which your heart rate is 60% of your maximum heart rate every day for 5 days a week. That should suffice as an exercise. So what are the common exercises you can do during the days of lockdown? It is impossible to travel to long distance places. It is not wise to go to a gym. It is not good to go to a swimming pool. And most of those institutions are closed down already. You can engage in physical activity either in the courtyard of your home or in front of your home on the road. Don't go to distant places. Don't walk away to distant places because it is not advisable in the days of this COVID pandemic. So you can do brisk walking, jogging or cycling in front of your home or on the road in front of your home. So 30 minutes per day for 5 days a week. So again, when you are exercising, one more thing to be taken into consideration. If you are doing brisk walking, you cannot just get up and start walking at a rate in which your heart rate would be 60% of your maximum heart rate. You have to start by walking very slowly. The first 5 minutes should be very slow walking, what you call as warm-up period, very slow walking. After that, after 5 minutes of slow walking, you can increase the pace of your walking to the level where your heart rate is 60% of your maximum heart rate and sustain that pace for the next 30 minutes. That would be the phase of moderate exercise. And after completing 30 minutes of moderate exercise, the last 5 minutes again, slow down the pace of your walking. Walk slowly, reduce the pace. and that is known as the cool off phase. So every day, if you are resorting to brisk walking, you need to walk for 40 minutes, 5 minutes of warm up, 30 minutes of moderate exercise, and finally 5 minutes of cool off. Then you can stop exercise. It would be wise if you can do this exercise either in the morning or in the evening with exposure to sunlight. What is the relevance of sunlight? When you expose yourself to sunlight, your body synthesizes vitamin D. Vitamin D is very vital for every human being. It is important in building your immunity. If your vitamin D levels are normal, it is possible that you can fight COVID virus or any other viral infection well. Vitamin D is very important for the strength of the bones, the teeth, the muscles, for your physical energy levels. It is also important for your information processing function of the brain. Those of you who have got diabetes or hypertension, it is very important that your vitamin D levels should be normal, because vitamin D, if the levels are normal, that can help to prevent the complication of diabetes, heart diseases, etc. So, exercise with exposure to sunlight for 30 minutes per day for at least 5 days a week. Then another one important thing is regarding the diet. Since you're sitting at home without engaging in much physical activity, you should restrict the amount of food you take, especially during lunchtime. You should use the food plate method of dieting. What is meant by food plate method of dieting? You can divide your entire food intake into 4 parts. 1/4 should be grains, carbohydrates. It can be rice or chapati or anything that should occupy only 1/4 of the total food intake for the day. The next 1/4 can be proteins. If you are a vegetarian, you can resort to peas and things like that, protein content vegetables. If you are a non-vegetarian, you can take fish curry or chicken curry, would be good for you. Better to avoid fried foods as much as possible. Next 1/4 can be green leafy vegetables. It is very important. Green leafy vegetables help to contain the lifestyle-induced disorders. It is excellent for your gastrointestinal tract as well. And the last 1/4 can be fruits. So divide your diet like this, and this is called the food plate method, and reduce the quantity of intake of fruits. So take medicines regularly, exercise regularly, and restrict the extent of food intake. One more thing is, you should not get addicted to the digital media. It is good to use your computers or mobile for maybe 2 hours a day, but it is not advisable to sit in front of digital equipments for more than 2 hours a day. And ensure a good sleep also. A good sleep for 8 hours a day is very essential in the days of the spreading pandemic. So you should practice what is known as sleep hygiene, so that you go to bed at the fixed time and get up at a fixed time. So utilize the lockdown days to contain your lifestyle-induced diseases, to develop a new pattern of exercise and diet, which can be continued even after the lockdown is lifted, so that the lifestyle-induced disorders don't affect you significantly. Thank you very much.